and I am here to talk to you about autism spectrum disorder and what it is. Let's start off with the first question. What is autism spectrum disorder? Autism spectrum disorder, or ASD, is a neurodevelopmental condition that, according to the CDC, 1% of the world's population, or around 75 million people, have. The amount of people on the spectrum are very depending on the country. For example, Canada's population has 1 to 2% of people on the spectrum, with 135,000 of those living in Ontario. While this condition first develops and surfaces in childhood, it does not leave after adulthood. It also is not contagious at all. However, it can be hereditary. Those with an autistic parent or sibling are 9 times more likely to have autism as well. What are the signs of autism spectrum disorder? Now, everyone with ASD is different, and some may not show these signs, but they are the most common signs. Stimming, which we will explain later. Body language, most famously raptor hands, or some sort of like a velociraptor when they are resting them. Hyperfixations, organizing things, avoidance of eye contact or too much eye contact, trouble picking up social cues, like, for example, not understanding sarcasm, aka verbal irony. Now, there are many terms that are related to autism spectrum and other neurodivergent conditions. For example, stimming, masking, autistic, which is the medical term for those on the spectrum, autistic for people who aren't autistic but could either be neurotypical or neurodivergent in some other way, comorbid conditions, neurodivergent, neurotypical, and a meltdown/sensory overload. So, what is stimming? Stimming is a repeated conscious or subconscious movement done to control stimulation levels. They can be tactile, like for example with a fidget toy, auditory, like humming, vocal, like repeating something over and over and over again, visual, taste, like involving tasting things, smell, or movement, like for example most famously flapping of the hands. I know I mentioned masking earlier, so let's discuss what it is. Masking is a subconscious occurrence done by those on the spectrum and many other neurodivergent people to hide any behavior that may draw unwanted attention. This can happen before or even after diagnosis, but not everyone can mask, and it is also very, very, very exhausting. Let's discuss comorbid conditions and what they are. Comorbid conditions are a condition that comes along with a different one. Along with, so for example, people with autism can have like ADHD as well, or anxiety, or OCD, or depression. I'm not talking about those right now, but I might in the future if I have time to. Let's also discuss hyperfixations and what they are. Special interests or hyperfixations are something that many autistic people have. Even some neurodivergent or other neurotypical people have those. Like, many people can have hyperfixations, they're just most commonly associated with autism. But like some common ones for those on the spectrum can be like dinosaurs, or like theater/movies, painting, writing, blogging, collecting things, trains, and like there's so many more, but the main ones that I've listed are the primary ones. And if someone is talking to you about their hyperfixation, please try to listen to them. You might learn something new, and it can help them feel accepted. Let's discuss something that's somewhat uncomfortable for some people, a meltdown. A meltdown is something that can occur due to sensory overload, when someone is too overstimulated. It can be very exhausting for the person. It's like, think like having a shaken up soda bottle. Like, when you open it, it's gonna explode. Or like having too many tabs open at once on your computer. It's not gonna work good. It's gonna like not do good. It's gonna break, or like lag, or like just like blue screen of death. But like some causes for overstimulation can be like loud noises, or like flashing lights, or like unpleasant textures or smells. Like a lot of people can be sensitive, especially if they're on the spectrum. And like if someone on the spectrum experiences too many overstimulating things like at once, or like in like a short span of time, it could lead to a meltdown. So please be patient with them. Try to help them through it, and don't try to restrain them. It could cause the person who is having said meltdown to get hurt, and there have been cases of people dying due to being restrained mid-meltdown. And it's better if you just be patient. Please be patient, okay? Thank you. So, what can you do to help? Well, autism can't be cured, and many people on the spectrum don't want to be cured. We just want to be respected. We want people to understand us and like not accommodate us and like respect our needs and stuff. But like there are many ways for neurotypical people to help. Like mainly by understanding and accepting those who are neurodivergent, like, not using ableist slurs because slurs suck. Researching what autism is, and realizing that just because someone isn't how society thinks they should be, that doesn't mean they're bad. And please remember, acceptance is always better than awareness. And don't support Autism Speaks. I could go in an entire tirade of that, but we don't have time. So I'm just going to leave it here. I apologize for that, like a bit of a rant. But anyways, thank you for listening. And I hope this video can help others understand autism spectrum disorder better and, maybe stop the stigma around it and other neurodivergent conditions.